Just 1 month after onset of the crisis in Ukraine, about a quarter of their population has been forcibly displaced, with almost 4 million Ukrainians having fled their country and another 6.5 million Ukrainians currently forcibly displaced within Ukraine. And there's a large part of the Ukrainian population that is currently inaccessible due to ongoing fighting, insecurity, and the Russian occupation. One of the main public health concerns and challenges in the humanitarian response right now is ensuring the continuity of life-preserving medications and medical care for people with chronic diseases, with non-communicable diseases, which have been the leading cause of premature death in Ukraine and globally. This is especially true for diabetes, in particular, since type 1 diabetes is probably the most immediately life-threatening non-communicable diseases, since in the absence of insulin, it is rapidly fatal. According to the International Diabetes Federation, there are about 2.3 million people with diabetes in Ukraine, which is about 7.1% of the population. For those individuals that have left Ukraine, that are refugees in neighboring countries, they are accessing fully functional healthcare systems. And while those systems are currently being greatly strained and overwhelmed, from what we are hearing, they are still able to manage this large influx of refugees and provide care. However, those that are currently internally displaced within Ukraine and unable to leave due to the occupation or ongoing insecurity, not only are their lives at risk due to the ongoing war, but hospitals are being targeted by airstrikes, supply chains are being disrupted, and critical infrastructure is being destroyed, leading to critical shortages in medical supplies. And of course, this is particularly concerning for insulin, delivery of insulin to the people of Ukraine, which need it for survival. From what we're hearing in the humanitarian response right now, those logistics of getting the medications from warehouses, from neighboring countries into Ukraine and distributed to the people has been the greatest challenge. The international community has donated large quantities of medications and supplies. However, the challenge really is distributing them. And these challenges more broadly around providing diabetes care in a humanitarian crisis that we are witnessing in Ukraine, these challenges are true for providing care in any humanitarian crisis. People need continued access to their life-preserving medications, diagnostic supplies, and care. Nonetheless, despite the very large burden of diabetes globally, the provision of diabetes care in humanitarian crises has largely been neglected and has not been very well coordinated so far. And so to address that gap and find solutions, an alliance of over 40 organizations called the International Alliance for Diabetes Action, or IATA, has formed to address kind of 4 key thematic areas in terms of providing diabetes care in humanitarian crises. The first is providing clinical and operational guidance. The second is ensuring access to essential medications and diagnostic supplies. The third area is improving policy, financing, and advocacy around this issue. And finally, improving data and research in terms of providing diabetes care in humanitarian contexts. For example, most recently, IATA hosted a roundtable with over 34 organizations that are involved in the humanitarian response in Ukraine to understand what the current process is in terms of coordinating care on the ground, what are the needs in terms of medications and supplies, what role should each organization play to avoid duplication, and clarify lines of communication, and to understand where are critical gaps and shortages in their response. While the Ministry of Health and the health cluster with the World Health Organization are coordinating the larger response, help from a variety of sectors is needed in order to provide this care. One example, a document that we recently developed was an insulin switching guide, which is needed because there are about 31 different insulins on the formulary in Ukraine. And if organizations are donating various insulins or only certain insulins are available, how do you switch someone from one insulin to another safely in this context? And so we've developed those resources, which can be found below this video. There's a link to these switching guides that have been translated into Ukrainian and Polish and different languages from the surrounding regions. And so that's just one example. We're developing more resources for people living with diabetes. How do you manage diabetes without access to food? How do you manage in freezing cold outside, avoiding, freezing insulin? How do you manage if you don't have access to insulin for a few days or prolonged period of time? So we would love your involvement. If you would like to get involved or if you have questions, there's a link at the bottom of this video to our website, iatadiabetes.org, and there's a section where you can, submit questions and contact us. So thank you very much for listening.